Even before the pandemic, the mental health crisis among children and teens was worsening. According to a CDC study, more than 1 in 3 high school students experienced persistent feelings of sadness or hopelessness in 2019, a 40% increase since 2009. In October 2021, the American Academy of Child and Adolescent Psychiatry, American Academy of Pediatrics, and the Children's Hospital Association joined together to declare children's mental health a national state of emergency. The effects of the pandemic on mental health are still unfolding, but we know that children are going to need us now more than ever. Jackson is 15 years old. He was struggling with symptoms of anxiety and depression before the pandemic. He had a hard time expressing his feelings and advocating for his needs. Often, when struggling to express their feelings, children communicate through their behavior. Jackson communicated his frustration by shouting at his family and breaking household objects. When his school switched to online learning, his symptoms became more severe. He couldn't stay focused and began falling asleep during class. He started to refuse to turn his camera on and eventually stopped attending classes altogether. Jackson's school filed a child requiring assistance application with the juvenile court because of his excessive absences. His probation officer referred him to Thrive, ACS's group treatment program. Thrive is a group treatment program for teens to help them learn the skills they need to cope with and overcome the challenges they face. We do not require insurance, and our treatment services are provided at no cost to families. When Jackson joined Thrive, his struggles with being on camera and participating persisted. His ACS clinician didn't give up, suggesting that Jackson try individual therapy sessions instead. After weeks of using different techniques to connect with Jackson, he finally turned on his camera, and eventually he started talking. His clinician realized that often his silence was confusion, not indifference. He had a hard time understanding emotions and communicating, especially in group settings. Jackson's ACS clinician worked with his parents, teachers, and providers to explain her observations and share what techniques she found helpful to communicate with him. She was able to translate his behaviors and provided Jackson's support system with strategies to help manage his anxiety and depression. Jackson rejoined Thrive, and using the skills he learned from his clinician, he became an active member. He completed all 8 sessions of group treatment. With patience, perseverance, and understanding, Jackson's clinician was able to help him gain the skills he needed to participate in treatment and return to school. Jackson is not alone. With your support last year, ACS provided services to 315 children. ACS clinicians completed 187 comprehensive diagnostic evaluations. 94 children and their families received education and advocacy services. 88 children received individual and group treatment. 382 hours of treatment were provided by clinicians at no cost to families. ACS's dedicated clinicians, individualized and evidence-based programming, and strong partnerships position us to respond immediately and effectively to the changing needs of young people. Last year, 88% of family members became more engaged in their child's treatment. 81% of children served increased attendance in school. 78% of children served improved compliance with treatment. These accomplishments are not possible without you. Thank you from the entire ACS staff.